I am Dr. Stephen Nichols, and I'm an orthopedic surgeon here at Andrews Sports Medicine and Orthopedic Center. I'm a small town boy. I grew up in Laverne, Alabama. I went to high school there and played sports there, primarily baseball and football. While there, I suffered a serious knee injury and had to have surgery in high school. There are many people who influenced me and helped me become a physician. I was influenced by my family doctor at home, by my orthopedic surgeon when I was in high school, and subsequently had another operation when I was in medical school by Dr. Jack Houston, who was a tremendous influence. I attended undergraduate school at the University of Alabama, where I earned degrees in chemistry and biology. I subsequently attended medical school here in Birmingham at the University of Alabama School of Medicine. Afterwards, I did an orthopedic internship and residency at what is now the Carolinas Medical Center, the Orthopedic Hospital of Charlotte. I was fortunate to have an intensive spine training, both neurosurgical and orthopedic spine surgeons, and these surgeons really influenced me into focusing on spine surgery as part of my practice. I've been with Dr. Andrews since he moved his practice to Birmingham in the mid-1980s, and I am one of the founding partners of Andrews Sports Medicine and Orthopedic Center. In many ways, I feel like I'm at the peak of my knowledge, my experience, and my ability. The main thing that attracted me to orthopedic surgery is that it is a specialty that allows us to intervene in a patient's life at a time perhaps of extreme stress and do something that will actually have a positive impact on their life and allow them to return to the quality of life they enjoy. My area of specialty is orthopedic spine surgery, but I treat injuries and diseases of the spine both medically and surgically. The focus of my practice is on minimally invasive procedures of the cervical, the thoracic, and the lumbar spine. I do treat disc disease, instabilities, and stenosis. I have patients that come into my office every day and they're extremely fearful of having back surgery, although they may have a clear-cut surgical problem that could be remedied or certainly greatly helped by surgery. They're extremely fearful. Back surgery now, though, is totally different than it was 20 years ago or even 10 years ago. One of our new innovations in treating the spine is use of the robot, the robotic arm, to assist with inserting hardware such as screws to stabilize our fusions. This is better for the patient because it is much more precise, it is much less operative time, much less radiation exposure, and minimally invasive, which usually leads to a faster recovery. I'm very fortunate to have great staff that works with me. They have many years of experience and they work very hard. I met my wife at the University of Alabama. We subsequently married while I was in med school, and we have 4 adult children, and I have 4 grandchildren, 3 grandsons and a granddaughter. When I'm not working, you can usually find me in the outdoors. I am very blessed to have a farm, to have lake property, and I thoroughly enjoy this with my family and friends. I'm sort of a work in progress amateur horticulturist and wildlife biologist. I'm fascinated by wildlife biology, and I actually have a vineyard and orchard at my farm, which I spend a lot of time in. I'm always planting trees, and I enjoy these activities with my grandchildren. I feel very honored that my patients will allow me to come into their life at a time of need and enter their life and provide care that hopefully will assist them in returning to their desired quality of life. I still love coming to work each day just as I did when I first started. My father always said, if you love it, it's not really a job.